All right, you guys, I know that this ethics lecture is quite long, but there's an awful lot to try and explain in it. So this is part 2. It is not nearly as long as part 1 was. Now, our society acknowledges the tremendous decision-making power that parents have on behalf of their kids. In most situations, the parents' decisions will be respected because they'll be based on putting the child's best interest first. They are the ones that understand what the patient would want, what they have gone through, and what they probably can handle. There are times when parents are not able to make the decisions for the children, like when there's suspected or actual physical abuse or neglect. A couple of ethical dilemmas that were in the news within the last few years. There was a Schofield girl who died of diabetic ketoacidosis on an Easter Sunday because parents did not feel it was in the child's best interest to go to the hospital. Instead, they felt that prayer would save the child. And then there was another situation with conjoined twins. If the parents decided to separate, the parents did decide to separate the two children, even though they knew one of them would die. Now, in situations where the healthcare staff or the nurse do not believe that the parents are making sound decisions, an ethical consult would be warranted. There's a potential to get the court system involved to protect the child. The dilemma is protecting the child from abuse when the parents have the right to privacy and self-determination. The most common violations with genetic research are confidentiality and informed consent. Insurance companies do not have the right to obtain a patient's medical records. That's good for you as a nurse to remember. A nurse should never impress his or her beliefs onto a patient. The nurse should be there to educate, support, and give references for services, such as an OB/GYN, abortion clinic, or counseling. And no matter what the patient's decision is, the nurse must accept the decision and provide effective care. All right, so the ethical decision-making process. Is it right or is it wrong? Now, when you're thinking about this, always make sure that you assess the patient's cultural needs as well. So nurses must develop a reasoned thought process and sound judgment in all situations that take place within the nurse-patient relationship. These are some difficult questions that you have to answer when making an ethical decision, and we'll talk about them. So step 1, you have to identify the ethical issue and problem. After all the data is collected, the nurse must bring the information together so that he or she will have a clear understanding of what the dilemma is. An example is a terminally ill elderly patient that's admitted to the hospital. The physician ordered the patient to be a full code as he didn't speak to the patient. The patient was a DNR. What would you do? Step 2 is stating the dilemma, and state the dilemma as clearly as possible. Recognize the key aspects of the dilemma will help you focus attention on the important ethical principles. Such ethical issues involve a question of conflicting rights, obligations, or basic ethical principles. Step 3, consider the choices. So do some brainstorming activities. All alternatives should be considered. So what are the reasonable possibilities for the action, and how do the different affected parties, like the patient, family, physician, nurse, want to resolve the problem? What ethical principles are required for each alternative? What assumptions are required for each alternative, and what are their implications for future action? And then also ask what, if any, are the additional ethical problems that the alternatives raise. In some cases, the nurse may need to refer the case to an ethics committee. Refer to the organizational policy and procedure on when to seek this referral. It may require input from outside sources, such as colleagues, supervisors, and ethical experts. And the slide shows you some examples. So step 4, analyze the advantages and disadvantages. and they have to be considered in detail. Consequences must also be thoroughly evaluated. The nurse should be able to narrow the actions down and use the code of ethics to assist in the final decision. And when making a decision, you must choose the appropriate code of ethics statement to support the conclusion. So some examples are performing CPR to the nurse's fullest ability despite the physician's order. Is this in the patient's best interest? If this is done, the nurse is also not following the MD order. Another example is not resuscitating the patient at all. So failure to resuscitate the patient may lead to a lawsuit unless a clear DNR order is present. Or only going through the motions or seeking another assignment to avoid the problem. These involve taking a submissive attitude and could make continuing practice in the institution very difficult. Other nurses are probably going to judge your ability to solve and clarify a problem correctly if that's what you're doing. You could also report to supervisor. Presenting to supervisor who may support the physician could lead to the supervisor looking at you as the squeaky wheel or one who does not like to follow orders. Regardless, this might be necessary for you to do. You can also confront the physician. Initiating conversation with the provider might anger them or cause them to distrust you. However, it may be the only course that you have to take. And then consulting the ethics committee. If you're unsure, this may be your best option, but it could cause others to view you as unable to try and resolve the problem on your own as well. So some things to think about. And then step 5 is making that decision. Decision makers must be prepared to communicate your thoughts through an explanation or the reasoning process that was used. Justification, you might have to specify reasons for the action. You have to clearly present the ethical basis for these reasons, understand the shortcomings of the justification, and anticipate some objections to that justification. The most difficult part of the process is actually making the final decision, following through with the action, and living with the consequences of that decision that you made. Unfortunately, most decisions are made with no follow-through because nurses are fearful of consequences to their actions. In an attempt to solve an ethical dilemma, there will always be a question of the correct course of action. The patient's wishes almost always supersede independent decisions on the part of the healthcare professional. An example is a collaborative decision made by the physician, nurse, family, and patient about resuscitation is the ideal situation and tends to produce the fewest complications in the long-term resolution of the problem.